That's a good one. So confidence, yeah. I mean, when I was in university, you're kind of led to believe that, you know, you're going to get your degree, you're going to go out, you're going to do your rotations, or you're going to learn a bit more, and then all of a sudden you're going to wake up one day and you're very confident as a therapist. And that is probably, you know, as far from the truth as there is really. Confidence takes a lot of work, and ultimately confidence for me, it comes down to the first thing is having clarity, okay, clarity in your mind. So for me personally, when I get overwhelmed, when I procrastinate, I stop. I don't take any action, and that can be whether it's for the business or with a patient. Procrastination, overwhelm, it's very, very dangerous, and it damages your confidence. And I think the amount of information out there these days, that can be very, very dangerous as well. And, you know, I was talking about it with, you know, when I went and studied the diaphragm and the pelvic floor stuff, I went too far down a rabbit hole of actually, you know, getting overwhelmed, procrastinating. And then what happens is you stagnate. Whereas now I keep things very simple, and the clearer that I am in my mind, the confidence, it just goes sky high. So the first thing I think is clarity in your mind, having a quiet mind, where you know the direction you're going, and you know the structured step-by-step systems being critical for me for that, because I know where I'm going with the patient, but I still have the freedom to you know, deviate a little bit and make it specific to what they want to do in life. The other big thing I think is support. I think it's having a community, family, friends around as well. I think that gives me a lot of confidence. And you know, even if I struggle with a patient, I know I've got 2 or 3 people that I can call, and I can say, look, this is what's happening, what's your thoughts? You know, and that's very, very powerful for me as well, because having that structured step-by-step system, I know that I'm just trying to work the patient to the next level of the great exposure program. Okay, and then all my attention is on that, but then I can actually go and I can make that phone call. And having that support network, I think it's critical to having confidence as well. And then the other big thing is the knowledge. Okay, so feeling prepared, having the knowledge to go into a session where, you know, it's a new patient walking through the door, you've no idea what their story is, but you know that you feel prepared because you have that structure. And that's something that gives me confidence. I remember driving down to London, I've told this story before, and it was a guy with an AC joint issue, and you know, I went in expecting, you know, naturally your brain, the little voice inside your head, it tells you, oh, you know, you're going to be doing this, this, and this. You see, oh, I've got a back pain patient next. So you can almost visualize in your mind you treating this back pain patient, but then they come in and you're like, okay, everything that I was going to do with them, all right, I could see in my mind's eye that I was going to do and they're absolutely fine. So it's like, right, I have to step back, I have to work, I have to think about this. And that's the critical thing with confidence, is it's training the mind how to think for me, really. It's stopping that little voice in your head saying, do this, this, and this because it's easy, and actually having to think and to clinically reason. And what I've got now really is I've got a structured way of thinking through an assessment. And that's so powerful, and that's probably the thing, you know, now that I'm chatting to you, that's the thing that gives me confidence, is I've trained my mind and I ask questions, you know, and my brain produces answers, and I can structure it in a very, very simple way. And once you have that simple way of doing things, you're not getting overwhelmed, you're not getting procrastinating. You know, your physiology is going to change in how you're speaking to patients, and I think that's very important for buy-in as well. So I think feeling prepared, having the knowledge there as well. And then, you know, I suppose the last thing that's really given me confidence, you know, it was scary when I made the decision to look at the body like this, where I'm focusing 80% of my attention on the what's not doing its job and 20% on the symptoms, after 3 years of like being not brainwashed but tunnel visioned on the symptoms, to then break away and go, right, I'm going to go and do this. And that could be scary, you know, to actually go, right, I'm going to do this with a paying patient who's giving me money, and I'm not going to spend 80% of my time treating the symptoms. It was scary. But once you start getting the results and you start to get the first win and the second win and the third win, that's when the confidence, it just starts multiplying. And that's when then I can go, right, you know what, come in, I'm going to listen to you, I'm going to shut that voice up in my head that's saying, trigger the glutes, trigger the QLs, all of these bad habits that I've developed. I'm shutting that voice up and I'm actually thinking, and I'm actually forcing myself to think, because we know the brain likes to take shortcuts, you know, and it's very normal. But what I emphasize to the therapists that I mentor is it's all about understanding the why we're doing things. And if you can understand that why, then that means you have clarity. And if you have clarity, then that's the thing ultimately that gives me the confidence to go forward with patients. And as I said, look, it's scary. You know, you're in private practice, you're in a pro sports setting, patients are handing over money, there's consequences for your actions in pro sport. But ultimately, it's having the clarity is the thing that gives me the confidence.